I would like to answer the question by the honorable member. Indeed, the community health program is critical because it brings health back to the community. And community health workers are a strong pillar in health system strengthening. And so we need to embrace them and support them. Working in Fikiria Jamii, which is which are 17 clinics in the eastern Isili region, the eastern side of Nairobi. It covered Shauri Moyo, Huruma, Madare, Kariobangi, part of Korogosho up to Kayole. We were able to strengthen the community health program. And what we did is ensure that they were bringing mothers for antenatal care, bringing children for immunization, distributing disinfectants, providing preventive promotion care and rehabilitation because they were part of the community. And the work was marvelous, and I'm happy that the country is embracing the community health program. And so we need to support them, and again, a consultative effort involving the multiple stakeholders so that as a team we can come up with action plans and interventions. Equally, we need to involve other sectors like the Treasury and see if we can have funds to allocate for their support. Additionally, partners are critical as well as the CSOs. So we need to involve partners to collaborate and synergize our efforts in order for us to have the fruitful implementation of community health programs and universal health coverage in general. For the emergencies, again, even as we transition, we need to ensure that they are covered, and we need, even in the UHC program, part of what is covered is
emergency
conditions. And so I believe that by incorporating this, all Kenyans will be able to access care even in emergent situations.
Honorable Robert Mbui.
Yeah, thank you, Mr. Speaker. Nominee, corruption cases have been a major problem in the health sector. Some time back, there were those clinics that were bought, containers that were being charged at about 10 million a piece, which was highly exorbitant. And recently also you've seen when we had COVID, there were scandals at KEMSA, and there was even a recent scandal under this regime which led to the dismissal of the PS then of health. What will you do to minimize, or if possible, completely eradicate this menace of corruption in that health sector?
Through you, Chair, I would like to address the issue of corruption by honorable member. Again, a consultative effort. It is important that we think strategically, involve the various stakeholders involved, the National Technical Working Group, the PSs and DGs, to understand, to conduct a situational analysis and see where the gaps are. But from my opinion, I think that we need to strengthen the processes and procedures that exist. And one of the ways is through a digital platform. That way, we reduce the human-to-human interface. We can be able to track, say, for instance, how a Panadol from batch 001 gets from the national up to the patient's hand.